Yes.
So my slide?
Yes.
Okay, perfect. Okay, so the case that I'm going to present tonight is it's a client I saw a few days ago, last week. I saw them last week. But the thing that sort of struck me about this is that this is what I see all the time. And I think Stacy, who's on here, who works with me in private practice, also will probably say the same thing. We kind of see the same thing all the time. Everybody is sort of doing the same thing. So the takeaway from this is maybe like what I might do different. So the theme of this is that it's all too common. So the history is Mom C. She's a 38-year-old G1P1. She had breast changes in pregnancy, no history of infertility, no thyroid problems, no breast surgeries, and her plan was to return to work in 3 months. She had a normal spontaneous vaginal delivery at 37 and 4 weeks. The baby's birth weight was 6 pounds, 9 ounces. And she only had attempts with the baby in the hospital. So all they did was feed formula. I want to come back to that in a second, but I do want to say that when it was time for the placenta to be delivered, she had a postpartum hemorrhage, and the placenta was delivered in chunks. She was transfused 1 unit of blood and sent home on iron. So going back to the attempts in the hospital, the dad said that it felt like the lactation staff kind of gave up really quickly. Like they tried to get the baby to latch a little bit and he wouldn't do it. So they said, well, let's just give him formula. Nobody even thought about starting her on a pump until day 2, apparently. They never tried with a nipple shield, which is usually the go-to in the hospital. If you've heard me talk before, I say a lot that when we're in the hospital, it's really difficult. We have a lot of things working against us. You know, we have the labor medications, we have the labor itself, we have how the baby was born. So the baby is recovering from birth. Maybe they have some facial asymmetry or some molding. Mom may have had a traumatic birth that led to bottom trauma, or maybe she had a C-section. You know, we have all these things working against us. If the mom had narcotics, that baby is really sleepy. If the mom had a epidural, maybe the baby is really disorganized. So we have a lot of things working against us in a really short time clock, because most families these days get discharged shortly after the 24-hour mark. They're not in the hospital for days and days. Even first-time moms, they go home really, really quickly. So in the hospital, the tools that we have are pretty limited. We have pumps, which don't work great when there's just colostrum. We have formula, which is used a lot. Sometimes we have donor milk, but most hospitals reserve donor milk for the preterm babies in the NICU. It's not always available for the term babies on the floor that are having trouble with breastfeeding. And then we have nipple shields, and that's kind of it. So most of the time in the hospital, we use a nipple shield sort of as a first line intervention, because we're like, we have to do something to see if we can get this baby to breastfeed. We also have hand expression too, but it sounds like from the report I got from this family that the lactation consultant didn't really do much of anything. They tried to get the baby to latch on, and I really haven't had any other patient that delivered at this hospital, so I can't speak to that being a trend or anything like that. But so nobody tried a nipple shield. They didn't teach her how to hand express. They just gave formula. And then on day 2, maybe it was a different lactation consultant. I don't know. The parents were poor historians, but they didn't start pumping until day 2. Maybe the mom was really exhausted from the postpartum hemorrhage. I really don't know. The information was pretty limited. The mother was pretty nervous at this visit. So I had to like really, normally I like come in with a lot of information and teach them a lot, but I had to like really back up and limit what I was saying to them or to her. Dad kind of went off in the other room for this visit. Because when we got the baby to the breast to try to breastfeed him, she was like shaking. She was so nervous. So anyway, this is what set us up here. So I saw the baby for the first time on day 5. The birth weight was, as I said, 6'9". So the baby was only down 1% because the baby has had all formula since delivery and, large volumes, up to 75 is what they said they were feeding him. They have done no breastfeeding attempts since the hospital. Mom started pumping consistently when she got home, which was about 2 days before I saw, or 3 days before I saw her. And she said that she was pumping every 2 hours, but then when I asked further, we kind of narrowed it down to probably about 6 times in 24 hours. She only had a wearable pump, a Mom Cozy wearable, and she was collecting 10 to 15 mLs per session total, which is very low for day 5. I noticed on the baby, he had notable jaw asymmetry on the left side of his jaw. And the interesting thing was he also didn't really open his left eye at all. And I asked Mom, is this normal? Does he usually open both eyes? And she's like, I don't know. So Dad kind of chimed in from the other room. Yeah, he doesn't really open that eye very much. So if you've seen any presentations I've done before, we have 12 cranial nerves. You need to know that for the exam. 6 of them play a role in breastfeeding, but in the birth process and in the position in the womb, those cranial nerves can be impacted. So my guess is that possibly the cranial nerve that affected the eye was impaired in some way. I mean, it was on the same side as the jaw asymmetry, so he probably had his head down like this. So if something's a little bit kinked, that's probably what's happening. He definitely didn't have any like blocked tear ducts or any goopiness in that eye at all. Just what I noted. Okay, so I tried to get him to breastfeed first without the nipple shield and then with the nipple shield. Mom's breasts were very full, but she had, well, I don't have a good breast model handy for this, but she had tiny little nipples. They measured about 8 millimeters, I think. So we tried to get the baby to latch first without the nipple shield, then with the nipple shield. And the baby latched on, but he just kind of pursed his lips and sucked like this. So if you think about the mechanics of what we need to happen at the breast, so the tongue needs to cup the breast like this, and it needs to make a nice wave motion like that to help strip the milk from the milk ducts. The nipple also needs to go far back in the mouth. So the baby, if he's, the nipple's not going to go very far. And he was sucking kind of like he would be sucking on a pacifier. But then when I saw him bottle feed, I saw he was a poor bottle feeder as well. So I taught, so anyway, we went through the kind of bottles that they were using, and I said, stay away from these, try these only. And I taught them how to do upright paced bottle feeding. So let me get to my care plan, and then we can see if you have any questions about this case so far. So I encouraged her to use the nipple shield and try to breastfeed a few times a day. I kept the bar really low because, as I said, she was so nervous. She was like shaking like this when I was helping her put the baby to the breast. So I didn't want to overwhelm her too much. Dad was in the other room, I don't know doing what, but she just seemed really overwhelmed. So I wanted to keep the bar as low as possible. And I said to her, the baby's only 5 days old. We have a big window here to make breastfeeding work. The most important thing is, I'm sure you guys heard me say it 100 times, feed the baby, protect the milk supply. So I want to make sure that you're feeding the baby appropriately. He was also taking like 60 minutes with the bottle. So when I taught them how to pace bottle feed using an appropriate nipple, it worked a lot better. And then I said, I want to focus on increasing your milk supply, because even if we did get the baby to breastfeed at the breast when there's 10 or 15 total, so maybe 7-ish per side, that baby's not going to be happy. So I wanted to increase the supply to a more appropriate volume for this age baby. Unfortunately, she only had a wearable, so I had to work with what I had available. I do have loaner Spectras available. I didn't have one in my car with me. So I at this visit, I measured her nipples and we tried some inserts for her wearable. Her nipples measured about 8 or 9 millimeters. I first tried a 13 insert in the wearable, but the problem, if any of you guys have had your hands on wearables trying to help moms, it's impossible to see where it's lining up and if the breast tissue is making good contact and going into the flange well. So with the 13, she felt like she couldn't feel anything. So then I pulled it out and I put a 15 in and she said, "Oh yeah, that feels stronger." So I said, "Let's use the 15s. Let's see how this works." A few days later, I did deliver to her a loaner spectra to try with the 13 flanges, and I verified with those flanges that this was the appropriate size and it looked good. And 13 is the smallest that I carry. There are 10s and 11s of the hard flanges available. You can buy it on Amazon. But I don't carry them that small because I don't usually need them that small. So 13 is the smallest I had available, and it seemed to work well for her. Okay. Any questions about what I saw, what I did, anything so far?
Margaret, did you have any interesting findings from an oral assessment?
Yeah, not really. I mean, he was just kind of disorganized, which I'm not surprised, based on what I saw with the feeding. He didn't have any restrictions or anything like that. It was just that he like wasn't really sure what to do. So if we think about those cranial nerves again, and now that I'm doing craniosacral therapy, you're probably going to hear me talk about this every time. If let's say the trigeminal nerve or hypoglossal nerve is impacted in some way because of the position he was in the womb or how he got pulled out or anything like that, he may not feel the nipple on his tongue so that he knows what to do with it. So that is probably part of the reason that he was feeling he seemed kind of disorganized and doing like this. So yeah, there was nothing structural like red flag. Oh my gosh, it was more like there's dysfunction happening here. Stacy.
Was the thing that you were describing with the left eye, did it seem like a tear duct thing, or were the eyes like uneven, or he just like literally wouldn't open it?
Yeah, definitely not a tear duct. I looked for that. His eye looked identical to the other one. He just didn't open it. He opened the other one. He was looking around, and I just happened to say, because I was noting at that same time the jaw asymmetry, and I said, "Does he open this eye also?" Because he really only had one eye open right that minute. And mom didn't know, but dad chimed in, "Yeah, he doesn't really open that one very much." So I said, "Well, let's keep an eye on it. Make sure we talk to the pediatrician about it. It could be that there's something, pinched and it just takes a little time." They said, "Oh, they told us there's probably tear ducts or whatever." I'm like, "Well, let's just keep an eye on it."
Okay, thanks.
Yeah. Yeah. Erica.
Could you go over again the baby's gestational age and the how the birth was?
Yeah. So the baby's gestational age was 37 and 4.
Okay.
She went into labor on her own. She pushed about 90 minutes. The birth itself went fine. The problem was that she had a postpartum hemorrhage at stage 3. So when the placenta was to come out, she started bleeding heavily and they had to manually remove it. Her milk did come in around day 4 though. So we don't think there's any retained placenta.
Thank you.
Yeah. You have another one?
Um I have, oh my gosh. Oh, it already, sorry. I was trying to
Okay.
figure out how to lower my hand, but it already did it.
Oh, okay. Shimon.
Sorry.
Okay.
Um, would you recommend like any kind of body work or anything?
Absolutely. Yeah. I did do a teeny tiny little bit of craniosacral on the baby, but I didn't want to like do too much or say too much because this mom was super nervous. So my plan is at the next visit, if I'm still seeing the dysfunction, to talk more about craniosacral and also possibly refer her for like chiropractic or something like that. The mom seemed like she was in super overwhelm. So I wanted to keep it as simple as possible and say, this is what you have the most control over right now. So let me make sure dad knows how to feed the baby and you know how to protect the supply so that we can work on making sure there's enough milk here. So when baby is ready, it goes better. All right, Gina.
Well, my first question was about a chiropractor.
Mhm.
But I was also just wondering, this is not about the eye or the jaw, but what bottles were they using and which ones did you tell them to use?
What do you think they were using?
Uh,
Avent. Always Avent.
Avent was going to be my guess.
Throw it out the window. Yeah.
Is that what they give them in the hospital?
No, it's not. But the marketing for Avent, I don't know. They're killing it. And everybody is convinced that Avent is a good bottle. But I mean, truly, I've seen moms have to go up to like a size 3 for babies to be able to transfer milk from those bottles.
Crazy.
So yeah, they were using Avent and they said, well, he seems to do really the best on, the bottle we got from the hospital. And I'm like, then stick with that. So this one, she said that he can do this one in a shorter period of time. And the reason that I like this one better than the Avent one is because this is more of a gradual slope. Yes, it's very shallow, but it's more of a gradual slope. With the Avent one, they're just on that tip, and the rate of flow is so slow.
Got it.
Do you have another question?
Yes.
Thank you.
Yeah, Erica.
Sorry.
Go ahead.
I'm wondering if there might be history with the mom of SA.
Yeah, I wonder too. But I didn't get into too much. She seemed really appropriate when I came back to drop off the pump, but there's only so much I can do in one visit. So I'm definitely keeping that in the back of my mind. And when I go back next time, I'm gonna sort of dig in a little bit more and see what I can figure out without triggering her. Yeah.
How soon in a consult can we recommend mental health support?
You can recommend it on the first visit if a mom seems like she's not coping well. And I didn't get that there wasn't good coping. I mean, she definitely had her clothes on. Her hair was dressed. She looked showered. But if you see a mom that really can't even do that, I would say you could do it. It's not, you're never going to do it too soon. But I didn't feel like that was the primary thing here. I was trying to sort of balance. Are you overwhelmed because the birth didn't go the way you expected? You had this scary postpartum hemorrhage, your baby. And one of the things the dad said was, we expected breastfeeding to go really easily, and it definitely did not at all. And we felt like we didn't have a lot of support. So that's was my primary. I'm going to start with this, and then we'll change it if we need to.
Thank you.
Yeah. Carling.
Private practice question
Yeah.
for nipple shields, bottles, flanges. Do you give those things to your clients? Do you sell them? Do you have them just for use and then tell them to go buy these?
Yeah, great question. So I purchased the flanges wholesale. I can share that link with you if you need it. I only purchase the wide mouth bottles, the ones that are basically compatible spectra, because that's what the majority of the patients that we see use. Or I purchase the inserts, which I don't love inserts at all. So if I have a patient that needs the correct size flange or insert and I have it, I measure it and give them to them. If we don't have what they need available, I'll measure and give them a couple of sizes to buy. Every state's different, but in the state of Illinois, if you wanted to charge your patient for that, you would have to enroll to collect sales tax, and that's not worth it to me. And to purchase them wholesale, they end up being about $3 a piece. So it's not horribly cost prohibitive to be able to solve it today. So that's what I do. For nipple shields, unfortunately, we can't really buy them wholesale, so I purchase them usually off Amazon or wherever I can find them. And they cost probably about $7 a piece, but I don't use nipple shields very often. I really don't. Like, I don't know, Stacy, what do you think? I probably use them maybe at the most once a month, but not even that often.
Yeah, there were a couple of cases where I was super, super glad that I had one in my car.
Yeah.
But yeah, I also don't use them very often.
Yeah. And then for bottles, I have a lot of bottles for education, but I have like some wholesale bottles and nipples in the car for an emergency. Like if somebody needs to supplement this baby and we need to bottle feed them, I have that available, but I don't usually provide them to the parents. They usually have, most of these families purchase the bump box or whatever it's called, where they get all these samples. So out of all those samples, usually one is appropriate. So they usually have enough. Does that help?
Yep, thank you.
Yeah. Louisa.
How did the baby do with the nipple shield?
Yeah, didn't do anything. That's what he did. So he didn't transfer any milk at all. He just kind of sucked on it like it was a pacifier and could not get into any kind of rhythm. So that's why I switched to let's just focus on protecting the milk supply. We're going to offer the breast just so she has some practice. Focus on protecting the milk supply. And then at next visit, which is probably going to be on Wednesday, we're going to try to breastfeed again and see what things look like. All right. All right. So let's move on. So the key issues here, there's quite a few, unfortunately. Mom's age, remember she's 38. 38 first-time mom. 38-year-olds tend to, as moms get a little bit older, and it's poorly understood why, but they tend to struggle with supply a little bit more. She also had that postpartum hemorrhage. She didn't have any documentation of how large the hemorrhage was, but the fact that she got transfused tells me it was pretty significant, because I've seen moms that tell me they have a hemorrhage and they were just given some iron. So a postpartum hemorrhage requiring transfusion is usually pretty large. She did tell me her hemoglobin went down to 7, but that's all she knew. Infrequent stimulation out the gate was a problem. That really set her up for a poor supply in the beginning. And she also has an inappropriate pump. Wearables have come a long way, and wearables can be great for some mothers, but they are not great primary pumps, which is why I offered the Spectra loaner to her to try it to see if that would help produce more milk. The baby problems are, that this baby has had early formula supplementation and all formula supplementation. No colostrum is given, which, in the past, I would say that's a bummer. But if you guys listened to my podcast a couple of weeks ago with Dr. Valerie Verhesselt, talking about how important colostrum is, just looking at the reduction in peanut allergy, colostrum is so important. And we don't even have, it's really going to be many, many years worth of research to be able to even categorize most or capture most of the benefits of colostrum. But it's so powerful. And this kid got zero. So we have to wonder what's the long term going to be like for him. He also had some jaw asymmetry and possible nerve involvement. So if he's a poor feeder, what's going to happen? He probably needs some body work. So yeah, those are the key issues. So when we look at, why did this happen? First, the national average, the most recent data we have from the CDC is for 22, unfortunately. So when we look at 22, the national average of ever breastfed is 85.7%, which is high. It's a lot. And it's right up there with where we want it to be for the healthy people goals. However, I know this is crazy, but every hospital that I've worked in, the lactation office was shared by the birth certificate clerks in every hospital. It's wild. So, it's actually pretty interesting though, because it gives me a unique insight into how the breastfeeding data is collected, because it's the birth certificate clerk that fills out the worksheet, or reviews the worksheet and enters that data into the state database, which then the CDC collects. So this kid who had zero breastfeeding in the hospital would have been in this 85.7% range because the intention on the mother's chart was breastfeeding. So it would have they would have collected him as a ever breastfed, even though he never did once, because that's not how the data is collected. The birth certificate clerk doesn't go in and look at every single feeding. It goes off of what the mother's intention was. And there's usually another question on the survey or on the intake sheet that the nurse will fill out whether or not the baby had formula. So it would say that this baby, and that would be this next number here. It would say that the baby did have formula, but it would also have categorized him as ever breastfed, which would be incorrect. So then the next number is the national average of babies that are supplemented within the first 2 days is 22.9%. In Illinois, it's even higher than that. So that means that, about 1 in 4 of the babies that I take care of are going to have been supplemented in the hospital. And realistically, the number is probably higher than that because the people that we see are people that are having problems. So this is a common problem. And without appropriate tools for lactation professionals or even the bedside nurses to help troubleshoot breastfeeding in the hospital, the number is going to keep going up. And unfortunately, we're not going to have numbers on supplemented within the first 2 days or exclusive at discharge going forward because they stopped collecting that data in 2025. So the exclusive breastfeeding question from the Joint Commission and the state, that question went away in 25. So that's really problematic. We're not going to have that data anymore. All right. So in an ideal world, I would have seen this patient prenatally. I would have done a breastfeeding visit with her to review the breastfeeding basics, what to expect in that first 24 hours, to know that you need to put this baby to breast within the first hour, ideally, and that the baby's going to be really sleepy, that you need to wake this baby to feed at least every 3 hours in that first 24 hours, because these newborns are going to pick sleep over eating, and it's a slippery slope. We're going to be at risk for blood sugar issues. We're going to be at risk for jaundice. We're going to be at risk for all these things if you don't have the right mindset that the baby's going to be sleepy, but the way you get to success is to wake the baby. I would make sure that this parent understands what to expect with a baby being very sleepy. And if the baby is too sleepy to feed, what you should do instead to protect breastfeeding. It's not just about feeding the baby, it's about protecting breastfeeding. I would teach and encourage antenatal hand expression in a prenatal visit. I usually give my mom some syringes, a little feeding cup so that they can, and the instructions and a video for how to do it. So if any of you are interested in my prenatal guide, currently I only have my branded one. I'm happy to share it with you, but I'm going to create a blank one that you can put your own branding on also. But if you want it now, I'm happy to share it with you guys. And it goes through what to expect in those first 3 days, how to get out of the hospital breastfeeding. And then if I were to see this patient in the hospital, I would have tried a nipple shield pretty quickly if the baby wasn't breastfeeding. I would teach hand expression. I would have used lots and lots of skin to skin. I would have probably tried finger feeding to help organize that baby and figure out what it needs to be doing. I would have tried to use donor milk instead of formula first if it was available. And I would have set this mom up to pump within the first 6 hours if her baby was not feeding well. I might have even had her pump a little bit because of postpartum hemorrhage, just to make sure her body is getting that message. But this is what I would have done differently. Anybody have anything they would add to this or questions that they might have around these ideal scenario?
I just have a question. I thought that you used to say that you wouldn't start actually pumping until 24 hours if the mom was with the baby, if they weren't feeding, like if they were actually separated, that's one thing, but
no, I usually say that, it's normal for babies to skip 1 or 2 feedings in the first 24 hours. I want you to try hand expression and try to get some colostrum into the baby. But if the baby skips more than 2 feedings, we need to initiate pumping to help protect the message to the brain. even if they're not separated. And finger feeding is a new one on here for me. There's not a lot of data around finger feeding, but as I'm learning more from Dr. Allison Hazelbaker, and learning more about craniosacral therapy, I'm learning how important finger feeding can be. And Dr. Hazelbaker actually developed a tool, the Hazelbaker finger feeder. This is what it looks like. It's very similar to an SNS, except that it's designed to be held in your hand like this while you're finger feeding the baby. So we can talk more about that. This is what I would do in an ideal world. So moving forward, yes, I'm going to keep an eye on mom's mental health. We're going to continue to practice breastfeeding. We may do more body work and work on the supply. I think that's it for this. Oh, going forward. Okay, feed the baby, protect the milk supply, continuing to latch. I may try a nipple sheet or a SNS also. I did not try it the first time because mom seemed really overwhelmed. Pumping until mom reaches a full supply and supplementing until baby's able to breastfeed. All right, I think that's it for this one. Yeah, okay. All right, any other questions or thoughts on this case before I open the floor to talk about whatever you want? Candace?
Any prenatal lactation related care?
Say that again.
Related care, like with only having a wearable pump and things like that? Like,
No, I think she just got her advice off of social media. So she didn't have a breastfeeding visit, anything like that. She really didn't know much about breastfeeding other than, the wearable pump is convenient. Yeah, it's
that's why.
unfortunate. It's pretty common though. Pretty common.
It's so common and it's so upsetting.
It is. Yeah, it really is. Chinese. Chinese.
Sorry, I am
Okay.
not able to work today. I was just gonna say about the prenatal thing. Something I've found out just as I'm trying to launch my business is that a lot of people only reference their provider. So whether that be their OBGYN or their family practice provider, and oftentimes they don't get the information. So it gets missed, unfortunately, because I've been doing free prenatal breastfeeding classes at our library, done too. And what I found is whenever I tell people about it, they're like, "Oh, it's fine. I don't need to go to that. I'll just talk to my provider about it."
Yeah.
And when the baby gets here, I'll figure it out. It's literally a free class. Just come. You'll learn so much. They're just like, "It's fine. I'll just wait and talk to my provider." So that's the unfortunate part.
Yeah, right. We definitely need to come up with a way some language to explain to moms why these prenatal visits can be so beneficial. So that's something I'd love to do going forward. Let me add it to my list. All right. Any other questions on this case before I hit stop?